Hello, everyone. So my name is Eric Brill, and I'm the Operations Director at Clackamas County Children's Commission. And on behalf of all of our staff, I'd like to welcome you to our Summer Camp 2020 Parent Orientation. So today we wanted to spend some time talking about what summer camp will look like when we start on July 30th. As you know, we're in the middle of a pandemic, and so we've been working hard as a team to find a way to welcome children back to our classroom safely, but also in a way that gives children a fun and valuable experience. So today we're just going to talk about some of the things we are doing to accomplish those goals and talk about some of the changes that parents and children will see when they arrive on July 30th. So with that in mind, I'm just going to get us started with handing it off to our Executive Director, Darcy, to officially welcome all of you to Summer Camp 2020.
Hi, everyone. I'm so glad that you're here and welcome to Summer Camp 2020. This is our first time conducting a summer camp. Summer camp was an idea that bloomed out of some extra funding that Head Start received as part of the Federal CARES Act. That act provided some response to the pandemic funding for multiple federally funded programs, and Head Start is one of them. The purpose of our part in the CARES Act was to provide some services to children who are transitioning from kindergarten or from Head Start into kindergarten, as well as children on IFSPs, recognizing that although we provided virtual services, they missed out on a significant portion of in-person services. And so this is an attempt to give them a little shot of instruction prior to heading into kindergarten, orienting them back into what it feels like to be in a classroom environment, and hopefully helping them to adjust to how classroom environments look different during this time of a pandemic, so that it will make the transition into kindergarten easier. Another part of the CARES Act funding was to help programs like ours with COVID-related expenses. So we've really invested quite a bit into preparing our buildings and our classrooms to meet the needs of our ever-changing world in times of a pandemic. And along with that, investing in some PPE, personal protective equipment, so that our staff can be safe while caring for your children. Next slide. So some of you might be wondering why we're engaging in this. And so a few pieces went into this decision-making process. First, we know for sure that children learn best in person. And so we want to provide that opportunity as much as possible, while also making sure that both the children and the staff who are caring for them are safe. We also know that there are some children that either because of their own health or because of a situation in their home environment, maybe they have a loved one that lives with them, that it might put them really at risk to have that child in a childcare environment. We're also offering a virtual option for families who need that. So we're doing both. I want to assure you that we are operating under emergency childcare regulations. So we're conducting services in very small groups of 10, with no more than 2 adults in each classroom. And that is to protect both the staff in that classroom and the children in order to make sure that both are safe. We are going to limit interactions with adults outside the nucleus of the classroom, again, to limit exposure from that group of children and to adults to others. We're paying special attention to safety. The staff today are going to talk to you about what we're doing to screen staff and children for symptoms. You'll see that drop-off and pickup will look very different than what you're used to. And I hope you understand that all of these policies and procedures are being put into place to protect you and your child and your family, as well as the staff who are caring for them. We've put extra sanitation and disinfecting procedures in place to make sure that the spaces that children are using are as clean as can be in order to minimize exposure. And that includes our outdoor environments. We have policies and procedures in place to make sure that those environments, although we know that those are a little safer than the inside environments, that we're doing everything we can there also to sanitize and disinfect surfaces. So one thing that's very different and really not something that we are totally comfortable with, but we know is really important for the safety of the children in our care, is that we're not having parents come into the classroom and engage with the children and the staff like we typically really want you to do. And so we've tried to think a lot about how do we make sure that parents can still feel like they're part of the classroom and still stay engaged in their child's learning. And so what I would ask you to do is really talk to your child, both before class, talking to them about how they're going to plan for their day. I especially would hope that you would talk to them about what that first drop-off experience is going to look like, because as you'll see with the presentations today, it will look very different. I think it's important for you to have those conversations with your child before you bring them in. And then I would encourage you after class to really talk to your child about what happened today. And I think we will be able to do some things to help you with that. So I'd encourage you to utilize Class Dojo to find information on what the classroom is doing and to help you talk to your child about what activities they may be doing, what they might be experiencing. Get ideas from your teacher about the things you can do to extend learning at home. And finally, communicate with us about how your child is doing. Tell us about what they're saying about their experience. We definitely want to know that. And so another thing I would ask for you is, you know, it takes all of us working together to make sure that the children in our care are as safe as possible and the staff caring for them are as safe as possible. So I'm going to ask you to wear masks when you're outside of your home to protect yourself, protect your child, and also just to protect the people that your child is coming into contact with. Stay home when you can. We know that that in and of itself is really helpful too. And then monitor your household. If someone in your family has the symptoms of COVID, then really pay attention to that and seek medical care if that seems appropriate for you. But certainly, you know, just keeping an eye on how people are doing in your household and then knowing what those symptoms are is super important. And because we're really focusing on Head Start children transitioning to kindergarten, I would say prepare for the transition. So you want to get registered for kindergarten. If you need help with that, let your teacher know. They can help you find out what your school district is doing. You might want to check out this website. It has all, or it will have by August 15th, it will have all of the school district's blueprint plans which is the plan that school districts have to submit to the state about how they plan to serve children this fall. That will be really important for you to keep an eye on and be mindful of. Think about what's best for your family. A lot of school districts are offering a variety of choices, and only you know what works best for your family as far as those choices go. And then prepare your child for that experience, just like you're preparing them for this summer camp experience. And then if your child happens to be one of those that's returning this fall to CCCC, then I would ask for you to be watching out for information from us via emails and texts and on our social media about our fall planning process. We too are engaging in that planning process right now. So I hope you have a great time at summer camp. I hope your child enjoys the experience, and I hope you enjoy the experience. And we're just so happy that we get to welcome children back into our doors and continue to partner with you in your child's learning. So have a great couple of weeks, and I look forward to hearing from you.
Thank you, Darcy. And so we are fortunate enough at our agency to have a really fantastic health team, and you can imagine they've done a lot of work and been very busy trying to plan for all of the summer camp portion of their work. So with that in mind, I'd like to hand this off to Robin.
Hi, everybody. Hello, parents and guardians and adults of the special children who are going to come into our program. I am the Health Services Manager for Head Start and Early Head Start. My name is Robin Alper, and we're really delighted that your child is going to be attending summer camp with us. As Darcy mentioned, we've been working really hard to make sure that camp is going to be safe and fun for your child and our staff. And I wanted to take a few minutes today to share with you some of the changes we've made in our health practices and our procedures that are based on the guidance and information from the Office of Child Care, the Oregon Health Authority, Centers for Disease Control and Prevention, Clackamas County Public Health Department, and the Office of Head Start. Eric, can you forward the slide? Thank you. As you know, the world, our country, our state, and right down in our community, we are fighting a new coronavirus. And prior to this year, none of us have ever been exposed to this particular virus. And for that reason, we're seeing many cases of this, and as well as deaths. And while we're learning something new every day about COVID-19, which is what we call the disease that the coronavirus causes, there are a few things that we do know. And so listed here on the slides are things that we have learned early on, and we continue to learn, but that remain pretty steady in terms of the characteristics of COVID-19. So mostly it is spread through respiratory droplets. So that's those little bits of liquid that come out of our mouth when we're talking and coughing and sneezing and we're laughing and we're singing. It also can be spread by touching a surface, and then that's contaminated with the virus, and then we put our hands in our face or mouths, and we get infected that way. That is not predominantly how it's spread. It really is person to person. And that is why anytime people gather together, there is a risk of spreading it from someone who might have COVID to people, those of us who might not have COVID. And what's not completely unique, but what makes COVID more challenging to get our arms around and keep our cases down is because we know we're contagious before we get sick, or some people are actually contagious with the virus, but they never show any symptoms. They don't know they are. So that's pre-symptomatic and asymptomatic people, fancy words to say it's we can come in contact with people who don't present as ill at the time we're in contact with them. And so it spreads more quickly and faster that way. One of the areas where we're not sure about, we know in general children are having milder symptoms than adults, but we're still trying to figure out what role they play in the spread. Do they spread it more, or do they spread it less than adults do? And one of the things that has remained very consistent in all of the literature and the data we've collected in the last 5 or 6 months about COVID is that from the time I'm exposed, and if I'm going to show symptoms, those symptoms are going to show up between 2 and 14 days after my exposure with someone. So that window of up to 14 days is a pretty long time, and you'll see that number pop up when we talk about exclusion from school or how long we should stay home if we've been exposed to it by someone who's positive. So here are the most common symptoms that we're seeing in people who test positive. And if there's one thing we're learning about COVID, it's that people have very different experiences when they actually get the virus. So some people get very sick, and they're sick for a very, very long time, and they have lots of different symptoms. Other people experience mild or moderate symptoms, and they may only have 1 or 2 of those that you see listed here on the screen. And so it's important, as Darcy mentioned, that we're familiar with what these symptoms are, and that we're watching for them in our family members and people that we're living with and people we're coming in close contact with. So in light of all that, there are practices that I want to talk about that we will be doing at camp when your child comes to be with us. And some of these practices we have had in place and followed well before COVID arrived here. And we will continue doing them as we always have. And we ask that you practice these same things at home. So hand washing seems so simple, but it continues to be one of the most effective ways we can protect ourselves against COVID-19, but really all viral and bacterial illnesses. So the key to washing your hands is make sure you're doing it frequently, and it's for 20 seconds. And plain soap and water is just fine. That's what we'll be using at school. It's what you can use at home. Hand sanitizer is okay as a backup when there's no soap and water available, but I want to make sure that you check the labels on your hand sanitizer that you have and that the active ingredient is at least a 60% alcohol. And also I wanted to make you aware that very recently, as of last week, there's been recalls of a number of hand sanitizers that contain a toxic chemical called methanol. That's not listed on the ingredients, but the FDA has identified certain brands that have been recalled. I don't have a list right now, but certainly you could do a Google search or just type in recalled hand sanitizers, and you will get that fairly lengthy list, actually. So I encourage you to take a look at that. Coughing and sneezing into our elbow and not our hands is another thing we've always taught children to do, and that if we catch our cough or catch our sneeze in our hands, we go wash them right away. And of course, next to that, if we don't go wash them right away, we want to keep our hands out of our faces and our noses and our mouths. And the truth is, there's been a fair amount of research lately done to show that we all, children and adults alike, touch our face a lot more than we realize. And so we need to wash our hands, and we also be very mindful of not putting our hands in our face, really never, if we can manage that. It's also important now more than ever before that your child stays home from school if they show COVID-19 symptoms or have symptoms that other symptoms that might require them from exclusion from school. And we'll get to that in just a minute, but that is really, there's in addition to all of sort of those hand washing and covering your cough, wearing masks, this one is critically important now for the reasons I mentioned before, that we don't know when people are sick, so that we're spreading it that way. When we see symptoms, we all need to stay home. So here on this slide are practices where we have done these before, but we've made modifications or changes to them based on the new guidance that's out. So some of these will be covered in more detail by others later in this orientation. So I'm going to focus now on the daily health check when you drop your child off and what our policy and procedure is regarding exclusion from school for illness. Before I jump into those, I do want to make mention that for safety reasons, we will not be brushing teeth in the classrooms anymore at camp, and most likely not in the fall either. And so please continue to brush your child's teeth at home twice a day with fluoridated toothpaste. And remember, the best time is morning and night. And if you only can do it one time, at night is the most important time of all to do that. And so on the next slide, When you bring your child to camp every day, we are going to ask you a series of what I'm calling health screening questions. You'll see that first question there on the slide is we're saying, does your child have a temperature of 100.4 or higher? And that means we're asking you to take that temperature at home. So when you come to check your child in, you're verifying you've taken that temperature and indeed your child does not have a fever. Follow-up questions are listed there. We'll ask you if you've given your child any medication to reduce a temperature before coming to school, and has your child been in close contact with anyone in the past 14 days who's tested positive or is suspected of having COVID. The definition of close contact, the very simple one I'll say here, is contact closer than 6 feet and for at least 15 minutes of time. And so there's other details there on that slide, but that's what we'll be asking you to think about, and we'll be asking you about every day at arrival. The next 3 questions pertain to sort of symptoms you've observed in your child in the previous 24 hours. And so has your child had a new cough, shortness of breath that's unrelated to another condition? Has your child has chills or felt feverish? A sore throat, headache, muscle aches, loss of taste or smell, runny nose, diarrhea, and what's not listed on my slide that should be is vomiting. That's unrelated to another condition. These are all common symptoms. And when I say that, they're common to lots of different illnesses, not just COVID-19. They're also symptoms we typically exclude for in a regular, normal time when we're not in a pandemic. But in the pandemic time during COVID, we'll specifically ask you these questions. And I encourage you to keep these in mind and ask them to yourself before you get ready to come to camp. If you can answer no to all of these questions, that's awesome. Bring your child. But if you answer yes to any of them, we're asking you to keep your child home from school. So when children become ill at school, we have a procedure for carrying them while we're waiting for parents and guardians to pick them up. So if we see any symptoms that we think the child needs to go home for, we will call you to come pick them up as soon as possible. In the meantime, we have a staff person who will stay present with your child, and depending on the symptoms, that person will put on some PPE if it's warranted. So it's important that we have up-to-date contact information for you and others on your child's emergency contact list so we can call, get someone to pick up, and make arrangements to have someone come as quickly as possible. If you notice that your child isn't feeling well and won't be coming to camp, please call and let us know as well. And can I have the next slide? We will, when you call to tell us that your child's not coming, we're going to ask you to please give us some more information about the reason why. If they're having symptoms, we want to know what those symptoms are. We'd like to know when they started, how your child is doing, how they're feeling right now. Perhaps if you've connected with a doctor to talk to them about the symptoms, or you're planning on taking your child in. And is there anybody else in the household who is also sick or ill at this time? If the symptoms you're describing are COVID-19-like, and remember that list was pretty extensive and long, I will be following up with you just to talk about when your child could return to school. If your child is going to be absent from camp for non-illness related reasons, also call and let us know. But of course, the follow-up and when they can come back will be very different than if they're showing signs of illness like COVID or other illness that they have to be excluded for. So this exclusion summary chart looks very, very complicated, but what I'll tell you is essentially it's describing for us, and this is given to us by the Early Learning Division in partnership with the Oregon Health Authority, that when a child or staff member cannot come to work or come to camp, it describes when they need to stay home and when they can return after exclusion. If we call you, as I said, to pick your child up, we're going to give you a letter that explains the symptoms that we observed, and when your child could return. But again, I'll tell you that you'll probably get a call from me just so we can talk about when you could expect to return and how long someone might need to stay home, because the guidelines are actually quite complicated. And so rather than go through this entire chart, I just want to assure you that we'll have a conversation together and I'll answer all your questions, and we'll make sure that we're all on the same page regarding that. And so my last slide, I just wanted to highlight some additional practices that we've put in place to further safeguard the health of your child and our staff while at camp. These are things we haven't done before, so they're new. And I want to mention that our staff will be wearing face coverings or masks or face shields. And so to encourage you to talk to your child about this before they come to camp next week and help us make this change feel normal and okay to them. It will be different. It's going to be different for our staff as well as the kids coming. And I also encourage you to wear that face covering when you're dropping your child off and picking your child up each day. We want to be really mindful to keep that 6 feet of separation between you and the other parents and children arriving as well. And that's for the safety of everybody, which we care a lot about. And that's all I have, and I want to say thank you for watching in this entire parent orientation, and we really, really look forward to seeing you soon. Thanks.
Thank you, Robin. And with that, another big topic is education, and I'll hand it off to Raylene.
Thank you so much, Eric. Hi, I'm Raylene Donaldson, and I'm the Education Manager here at Clackamas County Children's Commission. And I just want to start by saying that we are so excited and ready to have children in our classrooms once again. And while we've really appreciated the ability to connect with so many of you online, there's nothing quite like working with children and families face-to-face. As always, we want to provide the best service possible while continuing to keep everyone as safe and healthy as possible. And I want to reassure you that we are still going to fulfill our mission by having nurturing classrooms. Our classrooms and staff will still provide instruction to help children develop social, emotional, and friendship skills, as well as offering age-appropriate learning activities and materials to help children get ready for kindergarten. We also want to provide children with structured time so they can learn to follow routines, practice self-help skills, and listen and follow to directions. We will still emphasize the importance of relationships with adults and also with their peers. But I think that we all know that things are not going to go back to normal or be business as usual just yet. So I do also want to talk about a few things that will be different when they come back. I will go over all of these changes in detail, but I'm also just going to kind of give you a brief overview of what will be different right now. The arrival and departure time will look very different, which has already been mentioned. We will also have learning materials set up just a little bit differently than you may be used to seeing them, and the classroom schedule might be a little bit different as well. Also, I wanted to let you know that we will only be having 10 children in each classroom when we usually are used to having 20. So, and we'll also continue to have the same 2 teachers in every classroom with those 10 children so that we are not crossover. We don't have a lot of in and out of our classrooms and multiple people going in and out of the classrooms during the day. So arrival and departure times are going to look very different than they have in the past, and we've tried to be very purposeful in creating a system that minimizes risk, and we will be here to support children and families as we adjust to the newness of this process. So parents and guardians are going to be asked to bring children to a designated entry at your center, and you will be met there by our education supervisor. The education supervisor, as Robin mentioned, will be wearing full PPE, meaning that they will have on a face mask as well as a face shield and gloves, and they will sign your child in for the day after they've completed the health check that Robin has described in her portion of the training. And so once you've answered all of those questions and your child has been signed in, the education supervisor will also ask you for your name to record who dropped the child off. And then the education supervisor will take your child to the classroom. At departure, you will meet the education supervisor at the designated entry, and the education supervisor will check for ID. And then the education supervisor will go to the classroom and get your child after, once again, recording the name of the person who is picking up the child. So as Robin mentioned, we do ask that when you're picking up and dropping off your child that you wear a face covering and that you maintain 6 feet of social distance from the other families that are picking up and dropping off. And we also want to just give you a quick reminder that any person picking up your child must be on your emergency contact list, and they also must have photo ID in order for us to be able to release the child to that person. Rosie Weiland, one of our mental health specialists, has created this video which explains some strategies that you can use to help your child with separation before you go to school, after you go to school, and during the actual drop-off process. So in this video, Rosie explains the strategies and also why they help your child to feel more secure while they are at school.
Hi, my name is Rosie Weiland. I'm a mom, a licensed clinical social worker, and a registered Circle of Security provider. I wanted to talk to you today about bringing your child to school or camp during the times of COVID-19. With so many things being new and different, we can lean into what we can do and the ideas of the Circle of Security and the Attachment Matters Project to help us during this time. There are things we can do on the way to school, at drop-off and pickup, that can prepare us and our children and reassure our children that they are safe and will be supported at camp or school. Having a consistent structure at the beginning and the end of each school day will help our children feel connected and safe. On the way to school, you can talk to your child in your own words and say, when we get to school, Amy will be waiting for us. She'll be wearing a mask, and some of the other people at your school will be wearing masks too. This is to keep you safe. Amy will ask me some health questions to keep us all safe, and we'll say goodbye at the school's door. Once we say goodbye, Amy will walk you to your classroom where your teachers will be waiting for you to welcome you in and keep you safe. I will be thinking about you while you're at school. Once you get to the school, you can walk with your child to meet Amy. And you can ask Amy, after she asks the health questions, are you ready to take charge of Grace and to keep her safe? Then you can say to your child, I'll be thinking about you when you're at school. Amy and your teachers are here to watch out for you and keep you safe. Then you could say goodbye. And when your child and Amy get to the door, you could wave goodbye or put your hand on your heart to let them know you'll be thinking of them. When you come back to pick your child up from school, Amy and your child will be waiting for you. You can welcome your child back to you and ask Amy if there was something that your child wanted to share with you about what they enjoyed at school. We want to support you and your child through this time, so please reach out to your teacher or the education supervisor if we can support you in any way. Take good care.
In this next video, Rosie actually demonstrates how to use these strategies by acting out, going to school and talking to the child on the way, dropping the child off at school, and then also what to say as she picks her child up from school.
When we get to your school, Amy's going to be waiting for us. She's going to be wearing a mask, and some of the other adults are going to be wearing masks too. Amy's going to ask me some health questions, and then I'm going to say bye. And Amy's going to walk you to your teacher, Alicia. she's going to be waiting for you to welcome you and keep you safe. And I'll be thinking of you while I'm away.
Good morning, Lily. You've come with your mom. I'm going to ask your mom some questions and then we will walk you to your classroom, okay? Does Lily have a temperature of 104 or higher?
No.
Have you given Lily any medication to reduce a fever before coming to school?
No.
Has Lily been in close contact within 6 feet for 15 minutes or longer with anyone in the past 14 days who has tested positive or is suspected of having COVID-19?
No.
In the past 24 hours, has Lily had a new cough or shortness of breath unrelated to any other condition?
No.
Has Lily had a fever or had chills or felt feverish?
No.
Has Lily had a sore throat, headache, muscle aches, loss of taste or smell, runny nose, or diarrhea unrelated to any other condition?
No.
Thank you both so much. Can you sign in, please?
Sure. Sign in.
Mom, are you ready for us to take charge of Lily and keep her safe?
I am. I was talking to Lily on the way to school that you and her teacher, Alicia, were going to keep her safe when I'm away. And Lily, I'll be thinking about you when you're away. And Amy and Alicia will keep you safe and watch out for you. I love you.
Come on, Lily. Hi, Mom. Hi, Lily. Hi, Amy. Lily, nice to see you. Lily had a great day. She wanted to tell you that she so enjoyed playing on the slide.
I am so happy that you have fun playing on the slide, Lily, and I'm so happy to see you. Let's say bye to Amy and to teacher Alicia and the school.
Mom, could you please sign?
Bye, Amy.
As Robin mentioned, our teachers will be wearing face coverings when they are inside the classrooms, and our classrooms will still offer interest areas or learning centers, but we will allow fewer children in each area at the same time. We will place fewer chairs around tables and set up activities in a way that encourages distance between students. That being said, we know that preschool-aged children are very social, and we do not expect them to maintain physical distancing at all times. This is why it is so important to keep the class sizes small and keep the groups consistent every day. We also plan to have materials separated so that each child has their own set and that they can be disinfected in between each use. Sensory materials such as Play-Doh, sand, and rice will be separate and labeled for each child. We will use visuals around the classroom so that children know expectations in terms of things like where to stand when they are lining up. Meals will be covered in detail by our nutrition manager, Kyla, but I did want to touch on a few of the more educational aspects of meal times. We know that meals are important times for both learning and socialization, and we plan to continue this as a time to promote skills. So we will have 5 children seated at each table, and we will space chairs as far apart as we can. One teacher will be seated at each table and will still encourage interactions and conversations during meal times. And sometimes we may choose to eat picnic style outside to take advantage of the nice weather. We know the importance of consistent schedules for preschoolers, and teachers will still have schedules set and have picture schedules up in the classrooms for summer camp. However, we will also be taking advantage of the summer sun. We will be playing outdoor for extended times when possible, if it's available at the specific site. We will be sure to take learning materials and activities outside for children to use while they're outside and to keep them engaged and learning. While the times may vary a little depending on each day, the schedule will never change in that we will always maintain a consistent set of events. So for example, they'll have a morning story and then wash hands and then go outside. And even though the time might be different, the routine will always remain the same. We will provide extra time for transitions, including plenty of time for thorough hand washing. Please be sure to apply sunblock or sunscreen to your child before bringing them to school if you want them to have that on before we go outside. So we have prepared a few videos for you with one of our education supervisors, Debbie, and one of our teachers, Tammy, that will just give you a little bit more of an insight as to what things may look like. So here's Debbie giving you a little bit of an overview on how she will look when you drop off your child.
Welcome to summer camp, families. My name is Debbie Stedman. I am the education supervisor here at Gladstone, and I just want to walk through what that's going to look like when you bring your families to school. So we're going to ask that families stay outside. The ES will be at the door to greet you. We'll ask you a series of questions, and then I will sign your child in, and I will walk your child to the classroom and hand your child off to the teacher, and then I'll go to the next family. At pickup, it will be a similar procedure where I will go and get your child from the classroom, and I will deliver your child to you and sign your child out at the end of the day. And I will also be asking you, if I don't know you or you don't look familiar to me, I will be asking your name, because that's what I'm going to be putting down on our sign in and sign out sheets. And I think that's all. And this is what I will look like with my shield on. So you might want to show your kids that this is what I might look like when they come to the center, and other ESs might look like this as well. Thank you. Have a good day.
In this next video, Teacher Tammy is going to go over what might be a little bit different about outside play.
Hello, everyone. I want to introduce Teacher Tammy. She's going to let you know about our playground and what that's going to look like for summer camp. Hi, Tammy.
So there are a few changes in that we're going to be outside a little bit more. We want to be out in the fresh air, and it's summer, so that's a good time to be out. One of the things we're going to do is be bringing out some of our classroom materials, so we'll do more activities outside. Since we're spending more time outside and hoping for wonderful weather, we're hoping that families who like to use sunscreen on their children will remember to put those on before bringing your kids to school, so that they'll be protected from sunburn. And we also ask that families have really good shoes for their kids on their feet. Flip-flops and sandals can get caught up in our bark chips, or they can get caught up on climbing equipment, so it's really best if they have their tennis shoes on.
Thank you, Teacher Tammy.
And now we'll give you a little overview of how meals might be arranged or may be different.
Hi, Teacher Tammy.
Hi, Teacher Debbie.
She's going to talk to us about what the difference is between our meals now. Tammy, did you want to talk about the meals and what that's going to look like for summer camp?
Yes, I wanted to let families know we're making some changes. Last year we did it family style and children would serve themselves. This year, to help cut down on sharing germs, what's going to happen is our cooks will have it all ready, all the food on the plates, along with silverware, and milk will come in little cartons, and it'll be delivered to our classroom. Teachers will wash their hands, glove up, and wear masks, and put the plates onto the tables, just like this. And then the children will wash their hands and come to the table, and their food will already be there. So there won't be any sharing of germs, just the food that's on their plates.
Thank you, Teacher Tammy.
And now she will go over how activities and classroom setup will be different and also help to protect your child while they're at summer camp.
Hi families, this is Teacher Debbie. I'm the Education Supervisor here at Gladstone, and this is Teacher Tammy, and she's going to explain to us what it might look like during summer camp with the individual trays for kids. Hi Tammy, did you want to tell us what you have in front there?
I will. We have different trays. What will happen is the child will come and they can play with the toys and poke them in or whatever it is that they want to do. When they're all finished, we'll take the tray and we'll sanitize it before the next child plays with it. Also, we do a lot of things at the table where they're writing or cutting or painting or gluing. So each child will have their own kit, and it might look different at different centers. Here at Gladstone, we're going to use these, and they'll have their own scissors, glue, markers, crayons, and paints. So if it's either our table activity time, they can get this from wherever the designated spot is and use it, and then they'll put it away. Or during our free choice time, if they'd like to use it in the art or writing area, they'll still be able to access their own tools, and that will help cut down on germ sharing.
Thank you, Teacher Tammy. That was very helpful.
Thank you all so much for your time to watch all of these trainings and get all of this information, but also for your understanding as we all work through these new processes and rules. We look so forward to seeing you at camp.
Thank you, Raylene. So next up is operations, and I'll be staying with you during this section. Today, I wanted to talk about how the operations department is working to support a safe and fun summer camp this year. So first, I wanted to summarize kind of what operations does at our organization. So overall, our goal is always to support classrooms and our education staff so our families receive the best services possible. And we do that in a variety of ways. We have facilities and maintenance, so they ensure that our buildings and classrooms are clean, safe, and are working well. We work with the state of Oregon to show that we're following all rules related to the Office of Child Care. We have an amazing IT department who has been working doing a lot of extra things the past few months as we've been working remotely. But they provide staff with technology to help increase performance and communication. And finally, our nutrition or food services department creates healthy and delicious meals for our kids. And so Kyla runs that department. She'll be talking about the work that she's doing and her staff are doing a little bit later. So overall, we just wanted to do our best to help keep camp safe. And so just over the next just few minutes, I'm going to be talking about how we're using cleaning and sanitizing procedures, signage, supplies, and communication to help accomplish those goals. So as we've worked through our planning process for summer, we spent a lot of time putting new measures into place to keep our centers as clean and sanitized as possible. We have new guidance and new procedures and policies in place for additional sanitizing in the classrooms. Some of that was already covered by Raylene in her section. And this will help reduce the transmission of infectious diseases. And we address many items within the classroom, such as restroom services, tables and chairs, toys, other high-touch areas that are common to have little hands all over them. We're also going to be using additional signage that's going to be new to our organization. Oops. Sorry. So this is one example of a sign that we're going to be using at all of our centers that just kind of is a good reminder about staying 6 feet apart. We'll have other signs that kind of deal with occupancy and that we're going to be limiting the number of folks that are inside each center. Operations is also supporting staff by ensuring that everybody has proper supplies to keep themselves and others safe. So based on the recommendations from our health team, which Robin talked about earlier, we're going to be providing lots of things to our classroom staff and our staff across the agency to make sure that they have what they need. And so gloves, we're going to be providing medical gloves in multiple locations within each classroom. There's a little list there of where those are going to be. We're going to be providing disposable gowns for staff who enter the classroom, as we talked about earlier, who are not part of that regular staff, and for a couple of other situations within each class. We're going to be providing disposable face masks to each classroom. And we're also going to be providing to all of our summer staff and beyond a couple cloth face masks that they can use and rewash. So we're going to be giving every staff member 2 so that they can use those. Maybe they're a little bit more comfortable and they have our beautiful logo on it. So that's always nice. We're also going to be providing each classroom with 3 face shields. And we really feel confident that having all these supplies available to each classroom will really help everyone feel as safe as possible and be as safe as possible so that we can keep all of the kids and staff as safe as possible. And then finally, I did want to talk a little bit about communication. And obviously, when we're talking about these services and heading into this kind of new way of providing service, I think communication is really important. And so, I mean, obviously, and as you know, our agency is spread out over a really large area with multiple centers and classrooms. And so to promote good communication, we've created this new tool for our summer staff to use to be able to communicate with coworkers, members of leadership team. So this is Microsoft Teams, and this is going to be a really great way for staff to be able to connect, to share their experience, to share successes, to talk about anything that they might be having a hard time with. It's not going to replace other types of communication, but we thought this was a really great way to help all of our staff to connect to each other and to leadership. So the operations team is really excited. We all are really excited to be able to serve our families again. And so on behalf of Tracy and Cheyenne in operations, Dave and Tom in facilities and maintenance, Brad and Kobe in IT, and Kyla in nutrition, I just wanted to thank you all for allowing us to be part of your summer. Really appreciate it. All of us do. And so with that being said, I'm going to hand that off to, speaking of Kyla, hand it off to Kyla in nutrition.
Hi, parents and guardians. My name is Kyla Portwood, as mentioned before, and I'm the nutrition manager. I have been doing this for about 2 years now and been with this agency for a little over 9. And today I would like to go over some things with you on how we're going to maintain a safe and healthy environment for your students and how we're going to continue to serve culturally diverse and nutrition meals under our new model, which was mentioned before, our restaurant style. Maintaining a healthy environment. As we began to develop this plan to reopen our doors, we took some guidance from the CDC and some guidance from other local kitchens that are operating. And we have developed some additional cleaning and disinfecting policies, along with some more in-depth training around how to wash your hands and transporting food. And also to further support the safest environment for our students, we have some additional trainings on food safety standards. All right, and what's happening in the kitchen? To limit some of the exposure risks, we are only doing 1 cook per site, and that we're not allowing any other individuals into our kitchen, especially since we're having cohorts. And the cooks will be labeling all equipment such as transportation equipment or just any other utensils that will be provided for our students. And that is just to make sure that each cohort has their own individual food, so we're not doing any cross-contamination between the cohorts. And we'll be also offering those meals pre-portioned to make sure that we eliminate the need for sharing. Okay, and then our new service model, which was mentioned before, we are doing a restaurant style now, which who doesn't like to get their food delivered in beautiful packages, right? Each student will be given a breakfast and a lunch under this restaurant style service. Restaurant style differs from our family service, And that's because everything is now going to be pre-portioned, and each student will no longer need to utilize like shared bowls or shared milk pitchers. And that is, again, just to make sure there's no cross-contamination or exposure. This just gives more safety behind it. Each student is given the required amount and the portion sizes. And I just want to say how excited I am to have laughter in our hallways again, and how much I look forward to feeding your families again. Thank you.
Thank you, Kyla. I appreciate it. And so next up, I'm going to hand things off to Liz to talk a little bit about some of the changes we're making within human resources for our staff.
Thank you, Eric. Hello, everyone. I'm Liz Kyle, the Human Resources Director for Clackamas County Children's Commission. I'd like to share with you some of the changes we've put in place for employees to protect the health and safety of both children and staff. During this presentation, we'll review some of our health and safety measures, how reporting to work will look different for employees, what the staff health certification includes, what happens when an employee is sick, and how you can help us keep everyone healthy. As part of our safety measures, employees will need to complete a staff health certification every day. They will be wearing face coverings at all times on agency premises. The only exception to this is that they may take off their face covering while they're out on the playground with the children. Employees will go directly to their classroom or their other work location, and they won't be gathering in any common areas. This ensures that they're not spreading germs from one to another. And only summer camp staff will be allowed on site. As mentioned in the education information, parents will drop all their children off outside. And in addition, no other office staff will be allowed on site during summer camp hours. We also have some enhanced protocols for how we deal with staff illness. Employees will find a number of changes in how they report to work. They will be taking their temperature before leaving for work. If it's over 100.4 degrees, or if they have other symptoms, they will stay home and call their supervisor. Employees will also be asked to bring a clean mask or face covering and a pen for their personal use, and will be asked to keep any personal food in a cooler in their car. These steps help stop the spread of germs that can happen when items and food storage spaces are shared. In addition to wearing masks, employees will enter and exit only through a designated door and will sign in and certify their health status. The daily health certification includes verifying that the employee is wearing a mask or face covering, has not experienced shortness of breath or any two of these other symptoms in the past 24 hours, has not come in close contact with anyone who has tested positive or is suspected of having COVID-19, does not have a fever of over 100.4 degrees, and that they will abide by all of the agency health and safety precautions. You may be asking what happens if an employee gets sick before or during work. We encourage all of our employees to stay home if they are sick. If an employee gets sick before work, they will contact their supervisor, who will ask them a series of questions and complete an absence form. The supervisor will direct the employee to stay home and will contact me with answers to the questions on the absence form. I will be consulting with Robin, who you met earlier, our health services manager, to determine what the next steps will be depending on the employee's symptoms. This could include excluding an employee from work for a specific period of time, contacting families about exposure, or contacting public health authorities. Each situation will be handled on a case-by-case basis. If an employee becomes ill while at work, The process is very similar, with the addition of immediately isolating the employee from the children and other staff in a designated sick room. We want all of our employees and children to stay healthy and safe. What can you do to help? If you have suggestions on how we can improve the health and safety procedures, please contact our Operations Director, Eric Brill. And if you have a health or safety concern, please contact me directly or any of our directors or managers. We very much appreciate your input. Thank you, and hope your child has a wonderful time at summer camp.
Thank you, Liz. And next up, last but not least, is Betsy in mental health. Betsy?
Hey, thanks. Thanks for saying last but not least too. That's great. So hello and welcome to all the parents and caregivers whose children are going to be attending our summer camp. You can just stay on that one for a minute. My name is Betsy Langston, and I'm the manager of mental health and disability services. I'm a licensed marriage family therapist, and I've worked for Early Head Start and Head Start programs for 20 years. So today, I just want to share some things with you that I hope will be helpful. First of all, and no surprise to any of you, this pandemic is really stressful and it's affecting everyone. And this slide shows you what we consider the 3 levels of stress. Some families are experiencing spending more time together with their families in a positive way. They enjoy it. Others are able to tolerate the increased stress because they have really good support systems that are helping with childcare and other needs. And yet for some, this experience may be causing toxic levels of stress or causing trauma. Next slide. Thank you. Regardless of what level of stress you are experiencing, if you have an awareness of what the signs of stress might be or trauma in your children, it can help you understand and be more understanding of these behaviors. So this is not an extensive list, but it gives you an idea of what you might be seeing. I've been hearing that children are maybe more irritable or sad or fearful. Some regression in potty training might be happening, maybe more clingy, difficulty separating, and changes in sleep and eating patterns. Next slide. The signs of stress and trauma in adults is going to be really similar. You may be noticing that your anxiety or irritability has increased, maybe difficulty concentrating, or memory problems, changes in sleep cycles. I know I've been feeling a lot more anxious, and there are some days when my mind is really foggy and I'm having a hard time concentrating. You can go to the next slide. So what can we do? It's good to understand that there are some areas that you have control over. It helps you feel like you can cope better if you think there are things that are within your control. So being gentle with yourself and others, always remembering to do that. Take a lot of breaks as often as you can. Make sure to get outside. We know that sunshine helps build immunity, and it also helps increase positive feelings. Be sure to normalize and validate difficult feelings, not only your child's, but your own. And take time to do some mindful breathing. At Head Start, we've taught children to do a star breath, which is to stop, take a deep breath, and relax. We also have taught them things like smell the flower and blow out the candle. So smelling the flower is breathing in and blowing out the candle. And that's something that you can do with your child to help them to calm down, or remember to take some mindful breaths. And again, practice kindness with yourself and others. Some factors that help you cope and help build resilience are listed here. Concentrating on nurturing your relationships, especially with your children, building a really secure attachment. If you haven't taken a parenting class or taken a child development course, you might consider doing something like that to increase your understanding of what might be reasonable expectations of yourself and your child. Always make sure you're maintaining your connections with your trusted friends and family. Be sure that you ask for help when you need it, especially with any basic needs, any health needs, transportation, or mental health needs. And do focus on increasing the social and emotional competence of your children. So as a matter of fact, what we believe is going to happen is that we can help with that social and emotional competence. Next slide. Summer camp is not only going to give you a bit of respite so that you can do better self-care and tend to things that maybe you haven't been able to for a while, but your children are going to benefit from the classroom experience and being with other adults and other children and getting some outdoor time. You watched Rosie's videos of how to support their drop-off and pickup. And in addition to all of that, our mental health team has other resources that are available to you. We can offer you one-time consultations or multiple consultations. We can provide resources and referrals for mental health services or social emotional supports. We have several interns that are available to offer individual counseling sessions or a child-parent relationship therapy model where parents are trained to provide therapeutic play sessions with their kids at home, and they get the support of the interns while doing that. If you're interested in requesting any mental health services, you can, of course, ask any of the staff members and they will make sure that we get connected. But you can also email, text, or phone me directly, and there's my contact information. And remember, kindness changes everything.
All right, thank you, Betsy, and thank you to all of the presenters for your time and energy today. So we know that there was a lot of information presented today, and we hope we were able to answer some of your questions. But if you have any questions, either now or in the coming days, here's some contact information for all the staff who were speaking with all of you today. And so with that, I just wanted to say thank you to all of you for taking the time to watch this orientation today. We hope that this helps to prepare your family for what to expect during summer camp. There's a lot of uncertainty, so hopefully this added a little bit of certainty to our summer camp this year. We are so excited to see everyone's faces again and have everybody back at all of our centers. And so thank you for allowing us to be part of your summer, and we're excited to see you on the 30th. Take care.